You have 4 minutes.
Yes, ma'am.
My name is Suzanne Tagg, and my address is 10700 Ladding. Thank you, council members, for your listening and for your time. I am here to give you some information that will help the city of Memphis save a tremendous amount of money. I want to talk about health care. Many of y'all may or may not know there's a new method in health care that's widely accepted from the federal down to the local level. It's called medication therapy management. 20 years of documented research shows that medication therapy management consistently in every study saves tremendous amounts of healthcare dollars while improving the health and the care of patients. The city of Memphis, y'all may or may not know, Cigna recently, I think in the past month, contracted with a company called PharmMD to administer medication therapy management to some of the retirees. That's a good move because it will save some money. I would rather it be a Memphis company than a Nashville company, but that's a detail. But I just wanted to educate you that medication therapy management is so widely accepted and so widely proven that in 2003 it was written into the Affordable Care Act as a requirement to be offered to Medicare patients. 18 states across the nation have implemented medication therapy management by matter of law or policy as part of their health care. Thousands of studies have been done, evidence-based studies. I want to point out 3. The first I want to point out was done in Asheville, North Carolina. It's known as the Asheville Study. Of tens of thousands of patients that were studied over a 10-year period of time, that study saved $2,500 per patient. If you extrapolate the fact that the city of Memphis has 23,000 covered individuals, that would come out to be over $40 million that were saved if that method was implemented into the city of Memphis's health care plan. Another study I would like to point out, it's known as the Minnesota Project. The state of Minnesota implemented medication therapy management into their state Medicaid system, and by doing so, reduced their state health care budget 31%. The last study I would like to reference was conducted right here in Memphis, Tennessee by Dr. Sahar Rashad, who is the head of the Medication Therapy Management Department at the University of Tennessee School of Pharmacy. She conducted a study. She received a grant from the Community Pharmacy Foundation. She conducted a study of only 50 patients, and she followed their health and their medications and their treatment, and she saved $5 million. If you want more details, I do have a PowerPoint presentation. I will be happy to email to each of you individually. But to sum it up, since last June, when I first heard that patients lost their benefits, I've been practicing medication therapy management, a light bulb went off in my head. I said, wait, if Memphis implemented this, it is possible. It's reasonable to believe that they could keep the health care benefits for all those people that are covered and at the same time save the needed money to pay down on the debt. So last June, I started researching. And initial research showed that it would be really easy to save $20 million if you really dug deep and had a detailed method of medication therapy management. Believe it or not, it's possible, reasonable, and believable that the city of Memphis, if they implemented medication therapy management in detail, could save $86 million annually. Now, I realize that the healthcare budget is only $120 million, but thank you very much for your time. I wanted to make y'all aware of what was possible so y'all could hold Cigna, you could hold this company that they've contracted with, PharmMD, and you can hold the administration accountable to do the best for our City of Memphis employees. As a citizen, I would like to see our City of Memphis employees treated the best. And yes, I hope and I pray that they could have their benefits back. I don't want to see a single person be cost out or lose health insurance. Thank you so much for your time.
Thank you, Ms. Tagg. Sherry Hopper. Oh, Councilman Strickland has a question for you, Ms. Tagg, quickly.
Two questions. First, I would like to you to email me your PowerPoint. Secondly, in a Reader's Digest version, like very short, how does medication therapy management save money? Yeah, how does it work?
Okay, thank you for asking. When you look, if the cost of health care were in a pie, about not quite 3/4, but a little bit of over half of those increased costs are due to hospital admissions primarily, physician's visits, and medications. So the short version is when a pharmacist follows a patient's medication therapy specifically, the patient is assured they get the best medicine with no interactions and no problems. The simplest analogy I can think of is, let's consider a diabetic. A diabetic can have a complicated medication regimen. It can be very complicated to keep their blood sugar under control. With one pharmacist that's following their care, they're more likely to keep their blood sugar under control and not end up in the hospital. Because what you need to consider is one diabetic ending up in the hospital for out-of-control blood sugar levels, the protocol cost of the treatment is $100,000. So I'm not good at being succinct, but how it works is you have to consider that 85% of hospital admissions are due to chronic diseases, arthritis, diabetes, mental illness, high blood pressure, heart disease, lung disease, tons of chronic diseases. So research over 20 years has shown the way you manage chronic diseases is medicine, right? When patients, and the research showed that when you go to the pharmacy, you pick up your medicine, you've just been discharged from the hospital, taking medicine correctly to get the best effect is not as simple as you think it is. I just by chance saw it because I was doing medication therapy management for a company that you might be familiar with. It's called First Pharmacy Services. So I had the opportunity starting about 4 years ago to see firsthand the difference that it made in people's lives. And then they were tracking how much I was saving, because if you keep somebody out of the hospital, you save a whole lot of money. So anyway, to sum up, please consider that 85% of hospital admissions are due to chronic diseases. When the patient takes the right medicine at the right time with no drug interactions, the short version, the simplified version, is you keep that patient out of the hospital and out of the physician's office. You keep them healthier, and by doing so, when you're really focused, it's amazing the amount of money that's saved, as well as the improvement in the quality of a person's life.
Thank you.
Thank you. Sherry Hopper.